much for having me here, and I hope and I wish everybody enjoying a good health with friends and families and in the neighborhood. COVID-19 is a unique experience for all of us to have a pandemic in this critical time. I have been working in refugees situations for a very long time, as I myself came from Darfur, where we have moved because of several reasons that my region have been hit by drought and desertification in 1983, 1984, and the people have made great move from sub-Saharan Africa towards my city, and then we have also obliged to move towards the center, the capital city of Khartoum, because of many reasons. And this drives my attention to take care of the issues of refugees since my childhood and onward. When I was in high school and then university, I did my studies and I worked as a lecturer in Omdurman Ahlia University in the field of environmental science, which I believe not very far from the issues of refugees and environmental catastrophes that we are facing in Central and East Africa. I came to Germany since 2017, and I started and initiated an NGO. It's a ICM, International Criminal Monitor, that deals with monitoring the crimes in my region, as we have been facing genocide in my place. I have been active here in the issues of refugees, especially the issues of deportation and the issues that very much linked to climate change and environmental issues. I have made so many public lectures and conferences in the issue. And today I would like to speak about migrants and migration related to COVID-19, how the catastrophe, the pandemic have impacted the lives of migrants and refugees and internally displaced people, and what we can do and how we can actively, positively active in these issues, as activists or as people who are living all together within the domain of this catastrophe now. I have prepared a small presentation, PowerPoint presentation, I would like to share and speak throughout my presentation. I can now share my screen with you. I hope my screen is clear to you. As of course, it's a concern of everybody of us. What is the fate of the migrants? Those people have been not in the normal settings of life, and that they are maybe in the borders, maybe in camps, maybe in IDPs camps. There is different settings, but we are speaking about a total of population of 272 million internal immigrants. And this is a huge number now in the whole world. And it's an issue, I think, that needs to be addressed by governments, by activists, by organizations, government organization and non-government organization, that they can put their efforts to tackle the issue of migrants. as it's now it's a global issues or the global phenomena that we can find migrants in every single country. But what's critical now to me, I think the people who are migrating now or on the move now, they are in great risk and they are in great danger because of the situation that they are living right now within their daily life. There is a set of reasons why we say that they are in this, they are particularly at risk more than the people who are settled down in their cities or in their villages. The first of all, I believe that the living conditions that under which the IDPs or refugees living are abnormal, and lack of adequate water supplies, hygiene, and so many aspects that contributes to the stress of the COVID-19, because I think the pandemic needs certain level or certain requirements that that person need to do so that to avoid having the infection. We cannot, as we all know, how it's important for everybody to wash hands several times. But when I hear this through media or through the outreach, it hits my mind that most of the people who are living, and most of these 272 persons, migrants or internally displaced, they are lacking clean water, so as they can use it for several times to wash their hands and prevent themselves from getting the infection. And this puts a real challenge over the whole world, how we can work together at least to do something positive for the human beings global wide. Because I believe the environmental issues we cannot solve or we cannot contribute positively to environmental issues if we are not globally united and having the solidarity to do the same thing within every single country. When we speak about climate change, we cannot make the preventive measures for climate change only here in Germany and leave it in Sudan, or leave it in Germany or do it in Sudan. It's a collective work of all human beings to reach the end point that we all need. And that's why I am very much concerned about the situation of the migrants within their settled dwellings. There is another reason for these people as that is not also compiled or that's not welcomed by COVID-19's preventive measures, like having been in borders. And in borders, there is hundreds of people that they don't have legal papers to pass these countries. They don't have any adequate food or water or normal setting of life so that they can do social distancing or cleaning or hygiene or enough food or medical services also. And this is not only also a concern for migrants or IDPs, the internally displaced people, but also in areas where we find people are in low income areas, like industrial areas or unserved areas, abandoned areas. Like most likely in developing countries, we find so many areas that the services like water supplies and sanitation is not achieved yet, which make another challenge for the people to combat the pandemic COVID-19. The third factor is the vulnerability factor. Why these refugees or IDPs, migrants, are vulnerable? Simply, sometimes there is discrimination issues coming to these issues because they don't have the documents that needed to to pass through the countries, or they don't have the visa, or they don't have any legal status within the country, and still they will be deprived from getting the service. The issue of also not having the refugee status within the country, it's also a big issue. And then those people who already have a short-term visas, like 1-year visa, they are not entitled, or they are not medically insured. They are not covered with insurance, and maybe they are also unable to get the COVID-19 medical treatment in hospitals or in medical centers. When they don't have this entitlement, then we are also very much concerned on how we could penetrate here to do something positive for those people, how we can help on the issue of having these people saved from the virus or from the infection. Again, most of those people, because they don't have papers, they don't have any normal settings of life, they have the stigma of being asked by police. If I am sick and I go to a medical care installation, a hospital or whatever, then I will be on the stigma of fear, how the police might ask me about my passport or about my visa, and I am already illegal. So most of them, this is one of the factors that deprives them from getting access to medical service. Again, we have also, like here in Germany, maybe these examples are all over the world as similar, but here in Germany, of course, we have also the issues of deportation. Most of the people are running or trying to escape deportation, and that's why most of them, they are living with not a normal setting of life. Sometimes you find them overcrowded. Sometimes you find the setting of these refugees camps are not, there is no adequate space that's needed, because you might find the room, and this room, it has like 8 or 10 persons within the same place, and then the social distances is kind of something impossible for these people. We need to review how, or we need to be involved very much of how those people can have the access of also social distance, because now social distance is a luxury for them. I can't distance myself, since we share a room, we are 10 persons sharing a room, we cannot. So we need to live together, we need to do our things together in one place. And this is a situation in much of the refugees camps. They are overcrowded with the density, the population density is very high within the refugees camps, be it in Europe or be it in any other countries. Again, there is another factor, like the language barrier. Some people, when they come, for example, to Germany, they don't know German, they cannot speak, they cannot ask, they cannot find the information. This that's why also here so many people can be engaged, so many activists can be engaged to pass the information for the refugees. And there is so many initiatives that I have select one to speak about it today, how people can make a community, non-state actors, how can be engaged in these issues. More or less also the level of education and knowledge and so forth, because most of the refugees, especially like in our situation in Africa, most of the people are illiterate, and some, they don't have enough education to know about the virus or to know about the preventive measures that they could do in their daily life to save themselves from getting the infection. As for example, nowadays we have Ramadan. In Ramadan we have ritual and habits that we eat together in Ramadan, and yet still people, they think, okay, we are not allowed to meet each other, but in Ramadan it's exceptional, it is so and so. And that's why here we need the services of the activists, of non-state actors, how they can penetrate in these communities and pass the information for the refugees and migrants, how they can prevent themselves from getting the infection. Another huge challenge, and so many people are working in these challenges, is a challenged access of food and water. It's now in the world we have a huge number of people are suffering hunger, and a lot of organizations working on these issues. But because of the lockdown of many countries, and the issue of instability or an irregular movement, people cannot, or the food cannot reach their targets, the people that need it. So this is how coronavirus lockdown has affected the migrants and the internally displaced people in a way or another, that they cannot get because they depend on the organizations that provide them with food and water. For clean water, there is lots of organizations that have been working of providing clean water within the internally displaced centers or refugee camps, but still these services believed to be below the requirements. Because we always have a huge number of IDPs every day settling or moving from place to place, and the services provided to them is under the limit or under the requirements of these people. And of course, food and water, we can still think about the hygiene, the sanitation, and so many things. Plus, I can speak about my country because I am working now on daily basis with the people in the IDPs camps. That these camps are lacking of medical services or health points. There is nothing, zero. And now we are trying to do something else, find other alternatives. As an activist, we are trying to find other alternatives that we can provide to people so that they can save themselves from the hazards of hunger or lack of clean water. This is in Sudan, in Darfur, in the IDPs camps, and the USAID providing some food and food rations for families, but still this food is below the needs of the dwellers of these IDPs camps. We have a serious problem of the outreach and advocacy. That because of the nature of this large number of population, that they have been deprived from regular education, and they have also been deprived from getting a normal life setting. In a way or another, I would want to say that the flow of information cannot reach them. When those people, for example, they don't have a television, because most of the Ministry of Health, they have made some videos to explain how people can help themselves from not having the virus and having the infections. But this advocacy cannot find their way to the refugees or the IDPs, the migrants in all, because in developing areas, like the people in the migrants, the Syrian migrants in Turkey border, they don't have televisions, they don't have electricity. So that's why these videos for outreach are not reaching them. And still, what we can do here, how we can bring about a method that can everybody get. But when we speak about videos or a newspaper or all this kind of media, the migrants, they don't have access to them. And most of them who are in the borders also of Italy or Germany or wherever, they don't have smartphones, they don't have access to internet, lots of things. So the flow of information is also another barrier. They cannot. There is, of course, a lot of efforts have been done by ministries, by governments, so that they can, in a way or another, pass the information. But unfortunately, this information, it cannot find its way to the target group of the migrants. One of the example that I have taken is one of the initiatives that we are working on is Sawa Sawa initiative for Corona confrontation. Is an initiative that is in Darfur. We have collected some money. We are trying to buy the PPE and distribute it to the people, but still our effort is beyond the numbers. The number is huge. In Darfur alone, we have 2,800,000 internally displaced persons living in IDPs camps. Within this huge number, our effort is very little. We are trying to do something as we feel like responsible of having something being done within these localities, but still we are concentrating of awareness, because also the local people are speaking different languages, and we are trying to find everyone with a local language of this group so that they can provide the information how they can prevent themselves from getting infected, or prevent the children, and how they can deal with the elders and with different groups of their societies. But still, when we have a look to the reports that coming from European Union or from Human Rights Council in Geneva, it says that the people, the migrants or the IDPs, are the ones at a great risk of coronavirus pandemic. In this level, this is all what I have done personally, how I contributed in the issues of coronavirus. But I think this pandemic is it is a collective action. We need a collective action that people in Germany, in France, in Sudan, in Turkey, everywhere. We cannot defeat this virus only with our collective action. And the same way of helping the other needy people, or the big category that I am interested in, the migrants and internally displaced people, is only through engagement of the non-governmental actors as well, because I know the governments are acting, but still us as activists, we need to be involved in awareness, or in providing these medical supplies for people, or also providing the medical personnel, because now in some areas we start to have small clinic. It's not a clinic, but still we are asking some doctors to go and work in this kind of areas. It's very unique, and it's very hard, we know, but still we have responsibilities towards these people, and we need to do as much as we can to save people from having this or passing together this catastrophe. Thank you for your attention, and I welcome your questions and your comments, and I hope this lecture has been interesting to you. Thank you.
Thank you very much, Eiman. That was very interesting to hear. So, thank you very much. And the floor is open for any questions you have from your side. And even though we can continue discussion with Eiman. So So Iman, you talked about some problems which refugees and people are facing defeating the coronavirus 19. If you can tell us how many people, or if you have any numbers of really affecting people who cannot reach medical health or health services in these areas or as refugees.
I don't have statistics here in Germany, because statistics itself can never be done in this situation. I guess we have one message here. Okay. Marco. Okay, Marco, thank you very much. I can read your message. Thank you for being here. He's saying goodbye. Back to your question, that statistics can never be properly done during the coronavirus, especially in developing countries. Maybe in Germany or in developed countries, people are making count about the infections and deaths and recoveries and whatsoever. But in a country where people they cannot reach these remote areas with a huge number of population, nobody knows, because all the estimates that have been made by human rights organizations, that they are just coding that it's going to be serious, it is going to be the people at risk are those who are in developing countries, in IDPs camps, that they cannot reach water, hygiene, or medical services itself.
Thank you.
I have a question which is specific to the context of Sudan, because obviously you're you're an activist from Sudan, and you're very much engaged with the situation there. And yes, in Sudan there has been an uprising and a lot of changes during the last year, and I would be really interested to hear how the situation right now affects the social movement, because yes, there have already been some achievements. I think just 2 days ago I read in the newspaper that female circumcision is forbidden now, which is a great achievement. But how does the situation of the pandemic, how does it affect the working of the social movement? Is it are they still continuing, and is it possible for them to still be active? Or also, how is the current government reacting? Are they using the situation that people cannot physically meet? Yes, I would be really interesting to hear something about that.
This is very interesting, because this is what I am doing now. I am part and parcel of a resistance movement, that peaceful movement that we have also participated in demonstrations and the sit-in during the revolution. Now with the coronavirus, our groups now, we have been, of course, meeting on daily basis through media, and we are using, there is lots of applications that suits Africa. And then we have, for example, we made this Sawa initiative. We have been contributing money, and with this money we have been buying PPEs and medical equipment from China and send it to Sudan. And then again, the campaign of the awareness campaign have been made by revolutionary groups themselves, that they took the initiative, because the government, it doesn't have enough personnel. And it seems the situation now in Khartoum, as the Minister of Health came and made an announcement that if the pandemic continues this pace, they are going to face a collapse of the health services itself. So how we can engage in this situation, we have changed our revolutionary work from a political issue to combat pandemic coronavirus 19. We have made different groups, among them people who are graduates from health faculties and this kind of universities. They are the leaders of the group. They train some groups, the same groups that we have been distributing ourselves into demonstrations. Now we have been distributed to go to remote areas in Sudan and try to speak or make awareness to the level of the refugees, IDPs camps, and in the villages also, because we have been a very good connection and network among us as revolutionists. We have within our organization, we meet on daily basis, we have our organization well working, and then we've turned our policy now is to defeat the pandemic coronavirus in Sudan and try to help the Ministry of Health, because our resources are limited, but still among us lots of people who are the graduates of universities and people who can provide public awareness how people could tackle the issue of coronavirus, and plus these community initiatives of Sawasawa that we provide the materials. People go to the villages, to the refugee camps, IDP camps, and distribute for them the mask and show them how to wash the hands, how to distance themselves socially, how to deal with the elders, how to deal with the children with the absence of education, no schooling, nothing, and they are trying to teach the communities, the local communities at the grassroots level, how they can combat coronavirus. Because in these areas, you can imagine, in my village, there is no electricity, and until now, when people want to charge their phones, they need to have battery and connect it and then have their phone charged. In this kind of communities, they don't know how to deal with coronavirus, and then it needs training. It's not a one-day issue, and that's why we have also been funding these people to stay in these villages for a while until they train the grassroots, the mothers and the parents and farmers in their farms, how they can be socially distant from each other, how they can enhance their personal hygiene, and how it is very much obvious now in this moment to do this practice as a collective work of the village. It is not, we have been trying to teach them in their local languages, because in Sudan we have more than 500 spoken language. So we are trying to find someone for each group to speak to them and teach them and train them how to act.
Thank you, Eiman. We have a question in the chat.
I'm checking the questions. I think the question has been answered, yes. Yeah. Yeah, all what we have been doing, we are trying to make use of the existing settings of people, our local people, using these revolutionary young girls and men to go and outreach and to aware their people how they can deal with coronavirus. Plus, we have also contributed something very unique, that we have also bought some food, and we've distributed the food to the poor people. It's not enough, we know, but it's an initiative that we would like those people not to get out from their homes. And we know how obviously when you ask someone to stay at home, not to go to work, and those people, they generate their income in daily basis. As here in Europe, I know so many of the refugees that they work per day. If they don't go out and work and do this work, they don't have money, simply. And that's why when somebody cannot go out and work, it's a question of feeding the family, and then starvation. Shall I stay at home and obey the order and not to go out or do anything, or I stay at home? So we find that when I ask someone not to go out, I need to provide at least something little that can sustain this family for a while until maybe we collect more money and more contributions to the needy people. But all in all, the places are different. Those people, those IDP camps that are found in fertile areas where there is trees and fruits and maybe woods and forests they can eat from the fruits or the harvest or anything. But there is areas that are really really dry and there is no any supplies, and then you are obliged to do something. We know that we have done very little and beyond the requirements, but at least this is what we have. This is what we think that this experience can add to the bigger organization to think about the local or non-state actors as a very important people to be engaged in time of catastrophe or pandemics.
Thank you. And there's another question. You can turn on your microphone.
Yes, it's on. I hope you can hear me.
Yeah, I can hear you.
Wonderful. Thank you very much for your presentation and good discussion. So I was also having a question. So I was experiencing these very well organized, formally or political active groups in Sudan within the past month. And what you described is that you're also basically, or that these groups are changing their focus from working politically. They are currently focusing on fighting the virus by raising awareness, by buying or being supported through international donations in order to buy equipment from China. So what I'm actually wondering is whether you are actually, because you mentioned that these groups are supporting the government, whether if it's this way or if it's actually that you're doing, or these groups are doing the major social and healthcare in the country, why the government should support you.
Thank you for the question. Because I know very well that like the Minister of Health or Minister of Interior, they don't have enough resources or they don't have enough capacity to deliver the service. So as revolutionists, we need to keep our people healthy and survive this catastrophe. So we've changed our agenda for the moment because this is one of our responsibility. It's not because of the government or anybody. This is our responsibility to our people. And how the issue is really how these people are effective to deliver to the level of the grassroots. When the government cannot reach remote areas or villages on the borders, there is always someone who's ready to go to this point and do the awareness and teach the people how they can survive or how they can do the protective measures. And of course, we have been split it into two. Those who are outside the country, we are having the obligation of paying our share of contribution to the group, and then making the communication and making the outreach with the suppliers and how we can get these stuffs, because it's not easy for us. We are not a company. We don't have anything. We start from zero, and we didn't have any experience of buying stuff from China and sending them to Sudan. But still, this is also a teaching situation that that it is in a way or another give us another dimension of being as non-state actor very much effective and do the service to the grassroots level. And this is the difference in the situation in Sudan. You can find the government is very much good delivering service within the capital or big cities. But when you go far away to the villages or IDPs camps or refugee camps in the borders, you find that the government have no capacity, have no any resources to cover all these people. So the initiative of the revolutionaries is something amazing, and I am very much enthusiastic to work within these groups because of the it gives us a new experience and a new dimension of how people can be effectively engaged.
And you want to react?
Yes, with two other questions even.
Yeah.
The first one, are these groups are actually receiving support by the government? And second question would be if you expect a change between, let's say the atmosphere between the government and this group once the COVID-19 is over, maybe the interaction between government and these groups, but most likely will focus on the political agenda again, might change if it creates a certain way of trust, maybe.
Actually, these groups, they don't have any support from the government. The government, they don't pay us anything. Even the money that we are buying, the supplies, it is from the contributions of the national citizens. It is not the money of the government because the government is doing through its institutions. They don't give these non-state actors money. And I think now the government should think the other way because they have been looking that they don't support very much the non-state actors, and it is nothing within the budget or within the program of our government in Sudan to supply the NGOs with money or with whatsoever, which I think now they need to change this image because these non-state actors or the NGOs have been very much effectively reaching the grassroots. And for the political question of these groups or how they can be involved, my opinion, my personal opinion, is that these groups, since they have the interaction with the grassroots level and they have the support, the support of all people in Sudan, they deserve to be within at least the National Assembly, because this is where the voice of the nations comes, where the people from different regions need to meet and to prevent or speak their plans of how the future of Sudan or the moment right away, what they need to do. I think when you find a political, this is not a political, but it is like active group or activist group of activists, that they can still contribute very much effectively on the government plans, because they are the ones from the people and they have the voice of the people and they can reach the people. So I know now within the corridors of our government, now they are starting to frame out how they can share the power in the National Assembly. But it would be a great loss if they have excluded these people from the assembly, because I think the revolutionary fronts or groups, they have the access to the grassroots. More or less, it is opposite to the political parties, that they exist in big cities and urbanized communities, not within the levels of the rural areas. Maybe because of the nature of our rural areas that is most likely governed or controlled by tribal politics or tribal groups, that each tribe has its own place, has its own tribal leaders, that they also act very well in the destiny of the group. And that's why I think the inclusivity of these people, it would add very much positively to what we are going to have in the National Assembly. And at any moment, I don't believe on the exclusion of these groups from the National Assembly, because it will affect the marginalized groups, the remote groups, the groups that are in a very far area, that their voice have never been heard. They have never participated within the structure of the government. And that is why I think after the revolution, we need to look at the government or at the parliament in a different way. Before, when the Islamists, the time of Islamists, we know how they bring about the representatives of in the National Assembly. But within this, the transitional government, the transition and the way to the democracy, we need to practice more or less inclusivity and have everybody, every voice being heard in the National Assembly. And I know it won't be 100% democracy or 100% transparency, but this is what we are looking for as revolutionaries. It would be a great loss if those people have been excluded from the political structure. Yes, you're welcome, Gabriela.
So I'm now unmuted. Hello to you. I have a question. What can I do personally to contribute to any of these activities here in Germany? I think many people don't know what to do for them personally. So my question is, have you an idea what we can do as an interested person in these problems?
Thank you very much for your question. The initiative that I have brought here, it's an initiative that has a bank account, and we don't contribute to person, but we contribute to the bank account, and we follow how this money being used for buying the needs of the target group, our target group. Still, I know the contributions were very much low, because for us, I am a refugee here in Germany. I don't earn much as I am not working yet. I don't have a job yet, but still we are contributing little money to our people. And I think one of the things that you can do at your personal level, people can contribute to these initiatives, and having the medical stuffs being delivered to the refugees camps. And I can contact you, or can bring you the bank accounts and show you how, with the photos, with everything, with videos, how to which level that we have collected the food and the distribution of food to the needy people. And the people of the revolution have gone door to door, knocking the door, sitting with people on the ground, try to show them how they can how they can distance themselves socially, how they can maintain good hygiene, and how they can protect themselves from being infected, because simply there is no any things. Now, at the last updates that we have, we managed to buy 100 respiratory equipment for those people, but they are not enough, because we have 178 camps we're still far away beyond. If we send only one respiratory device for one camp, then we have still 78 camps being deprived from the service. And we don't know what's really going to happen for those people. And that is why we are now just calling people to help, calling people, because in this moment we can't do anything. I can't go by myself, but I can still just contribute on communication. I can contribute money. This is what we can do at our level here in Germany. In the past, when there is catastrophes and pandemics, people used to fly to the target area and contribute and do so many things. But now at time, it's only depending on the brave people who devoted themselves to go out instead of us and deliver the service, make the awareness happen among the people, among the grassroots. And to me, this is the only effective way to save people or to save the humanity. And wherever in the globe people are doing this initiative, I'm bringing this because I am expected that a lot of people, maybe refugees also, they can copy this initiative to their places, because I know the refugee situations that I have showed and IDP's places are very much below the standards. And people can copy like this Sawa Sawa initiative and copy it to their places too. And this is how we can save the people for the moment until we pass through this pandemic, the COVID.
Do you have a flyer or a business card or something that can be dropped at the Flüchtlingskirche, for example, that people are getting the information or getting access to a website, or to perhaps you personally, if you are interested to be connected, to have this kind of information for people?
Yes, I do. We have opened 2 bank accounts, one in China, because we have the lucky situation. We have one person, Sudanese, is living in China. We have assigned him to buy for us things and make the cargo and everything. And we have bank account also in Sudan. So wherever you wish to contribute, you can have the access. And still following the initiative, it has also Facebook page, and they post the videos where the areas that they have been working, and you can see them straight away what they have been doing, what they have been delivering, because we know, of course, the issue of transparency, and we are trying to shortcut a lot of paperwork and a lot of things that we need to do and we are obliged to do in normal settings. But within COVID-19, I think we don't have time. We don't have anything to negotiate or to talk. We need action. It's the only thing that is working now. We act. So I think I can drop to Rika and Manal. I can leave them everything about this initiative, all the contacts and the bank accounts and the names and everything, and the telephone numbers. Also, they have hotline numbers. You can call and talk to them and follow up what they have been doing, because people are working very hard on these things. Trying to save, trying to do what we can ever be doing.
Thank you very much. Are there more questions? Or Manal, do you have another question? Also, those
more than a question, maybe it is just a comment that you are working on the topic of environment very closely, and I think COVID-19 is an issue who can only solve internationally and globally. That means it affects us right now and in the future. Is there any chance for us to work without taking care of our environment directly, and to cope with such diseases like COVID-19? Because I think it is not the only and the last one. Maybe we will have some more or another things. And I think it has to, or it has deep roots in environmental effects, or how we are dealing with our environment.
Thank you, Manal. I think it comes now to my mind that during preventive measures that we have been using for COVID-19, we automatically find ourselves doing the measures that we have to do for saving the nature and for saving environments. For example, now people are in lockdown. They are not using cars as usual, as the number of cars that is used on daily basis, and the carbon monoxide and carbon dioxide drop down drastically, because no people are not burning any fossil fuel in any sort or kind. And it has, of course, great effect. At least now we are enjoying clean environment from the emissions of carbon monoxide and carbon dioxide within the cities. But still, to me, the pandemic, it's like a message saying that it's enough for us. It's time to have the attention of our daily practices to our environment and to the ecosystems, because people have been doing so many negative things, but little that actually very much little beyond the expectation that have been done to treat the environment or to treat the international climate change issues, for example. I think the climate change, it's also something that could be done only globally, but the efforts have never been traced back to the grassroots level. For example, when you come, for example, to the sort of garbage or using things to the extreme amount, it is people are dumping a lot of food in trashes. People are not sorting their waste. People are trashing. They used to trash in the sea, water, plastics, and so many things. Now, if we do as we have done to COVID-19, if we have done that to teach our grassroots, even here in Germany, I had a dream and I talked to so many people about it, is that I want to teach the refugees about how they can contribute to the environment, to the new place that they come to, because we have the same way the lack of awareness and lack of education or anything, that the majority of I don't want to be more classified, but because of this is the situation, this is the status that we have, and it is reality, we need to be taught how we can deal with the environment, how we can sort our waste or garbage, how we can protect the environment, how we can use things to the maximum level. And this practice, I think the people need to change their behavior of being more sensitive to the environment, of being more responsible. Actually, it's not sensibility and responsibility towards the environment, not to degrade the quality of air or water anymore. It is more or less, now I think we understand that this thing needs to be done. We need to act together as one person to overcome the catastrophe, be it a COVID or climate change, or if we all abide by the laws. When we have a climate change protocol, all the countries should sign, all the countries should abide by this protocol, because this is what will save us. But you can find like Paris Protocol is not signed by this or that. So these practices still, we need to teach people that this for the sake of the humanity, this for the sake of the planet Earth. It's not for me, it's not for Germany or France or whatever. It's for the humanity, it's for the global issue. Now we are actually using several species on daily basis. But because nobody is feeling that, you can't see it with your eyes, and you don't care. You don't enhance your practices, daily practices towards protection of the environment. And this is the things that we really need to change on the personal level. For the environment, it's an issue of awareness also. So many people are not aware what to do. And also the same as COVID-19, problems of communication, passing the information, educating people. Maybe we need to put more or less programs for people who have never get this education or never get this information. I have seen here. Oh, thank you very much. But I think people are now with COVID-19, they are more or less also their daily program have been changed to have chance or time. Maybe it's not appropriate time for them to do such activity or come to listen to lectures, but we are not stopping. We are continuing happily to do such initiatives with so many people and have discussion rooms as much as possible, because this is the way that we can all of us come together in unity and try to pass the catastrophe.
Thank you.
Thank you very much. I think there was actually also a very nice final word at the end, that we only can work together and make it, and no matter if it's climate or the pandemic, that it's important to stick together and that it's for humanity and not just for yourself. Thank you very much. If there are not any further questions with regard to time, I would think maybe we would end today if nobody raises the hand or poses a question. Okay, then thank you for participating wherever you are right now, maybe in Berlin, maybe somewhere else. And thank you, Eiman, and yes, it was nice to see you.
Bye-bye. Bye-bye, thank you.
Thank you very much.
Bye.
See you next time.
See you next time. Thank you.